I am Dr. Mike Mulligan. I'm here with Dr. Lloyd Rudy, one of the most famous cardiac surgeons. Dr. Rudy, thanks so much for being with us.
You're welcome.
You know, we don't get the opportunity to be in the operating room, or even most people don't get the opportunity to visit with a cardiac surgeon who has had experiences with people near death or some who have already been pronounced dead and come back. And so that's what we're going to talk about here. In particular, one case, and may touch on another one. Dr. Rudy, why don't you tell us a little bit about that?
We had a very unfortunate individual who, on Christmas Day, had, from an oral infection, infected his native valve. If your native valve has the slightest defect, whether you were born with it or you developed it later, it calcified a little and the valve leaflets don't move or whatever, the body recognizes that as something abnormal that it's got to take care of.
Okay.
So that's what happened to this man, and one of my junior partners was on call, and he had to do an emergency valve resection. Once we were able to accomplish the repair of the aneurysm and the replacement of the valve, we could not get the person off of the bypass. Every time the 4 or 5 liters of blood that we were pumping around his body, we would reduce down to 2 or 3, he'd begin to weaken and his blood pressure would go down and so on. And to make a long story short, we simply couldn't get him off the heart-lung machine.
Right.
Finally, we just had to give up. I mean, we just said, we cannot get him off of the heart-lung machine, so we're going to have to pronounce him dead.
Right.
So we did that. And so the anesthesiologist turned his machine off, and the bellows that were breathing for the patient stopped. That machine was quiet. The anesthesiologist went into the surgeon's lounge. He hadn't eaten anything all day, so he went in to have a sandwich. And the people who usually clean up the instruments and all that were coming in and taking away all these tools. And my surgical assistant closed the patient in a way that a post-mortem exam could be done, because anyone who succumbs on the table has to, by law, has to have an autopsy.
Right.